So moving on to some specific acute neurological problems. So the first little group we're going to talk about that are specific and acute are vascular disorders. These have interference with a blood supply, so something doing with the blood vessels and blood supply. So we often see local damage and manifestations that depend on some kind of cerebral artery involvement. Some things that can happen is a hemorrhage is one type of vascular disorder where the hemorrhage causes increased intracranial pressure that leads to those general symptoms we talked about earlier, along with local ischemia and low oxygen levels. So we have, let's start back over. So we have the interference with the blood supply, which is due to the blood supply, the arteries that go up to the brain, hemorrhage inside the brain. We also can have global cerebral ischemia, which is where there is impaired perfusion of the entire brain, so we're not able to get the nutrients and waste away from the brain. And there's a loss of function in the generalized edema because the perfusion from the blood into the brain is not working correctly and can lead to brain death pretty quickly. Transient ischemic attacks, TIAs, these can occur singularly or in series, and these occur due to temporary localized reduction of blood flow in the brain. So some of the smaller arteries, arterioles, have temporary blood flow lost. And the reasons what can cause this are partial occlusion of the artery. So the artery is partially occluded and so temporarily has less blood flow. Plaques, atherosclerosis, very small emboli that are traveling through, blood clots that travel through, small ones get stuck and then they dissipate. A vascular spasm, where the blood vessel spasms due to some type of inflammation or something along those lines, and that can lead to a TIA, and also loss of autoregulation of the blood vessels. The signs and symptoms, it's kind of difficult. It's difficult to diagnose after the attack. It has to be done during the attack. The symptoms are directly related to the local area of ischemia. And some of the symptoms can include like localized weakness in one arm or one leg, or impaired function, visual disturbances, numbness and paresthesia, tingling, transient aphasia or confusion. Aphasia, remember, is difficulty talking. Repeated attacks can be an early warning sign of related atherosclerosis, where more and more of the blood vessels are getting occluded. That's TIAs. Then we have cerebral vascular accidents or strokes, CVAS or strokes. This is where there's actually infarction, brain death due to lack of blood flow. Two different major categories. One is occlusion due to the blockage of the blood vessel, due to embolism or atherosclerotic lesions with a blood clot. And then the second type is through rupture of the cerebral blood vessels. Within 5 minutes, the ischemia can cause irreversible nerve cell damage, and it can be a central focus of necrosis, and where all cell function is lost. And then after the first cell death, you have to worry about it spreading through inflammation and damaging the nearby tissues. So this bone that's nearby can regain some function with healing, but it's all those chemicals that are released through the cell death can damage the area outside of it. And so you can see there's a blood vessel over here, looks like it's broken, and it's a hemorrhagic infarction due to blood vessel bursting. So you have the occlusion type. Okay, this is where there's a blood clot that often develops in the large arteries. Some kind of atheroma develops this blood clot inside of the blood vessels. The obstruction can be caused also by an embolus, which lodges inside the artery. And With these types, it's blockage and we want to get it unblocked. That's the key thing. The other type is intracerebral hemorrhage. This is where the blood vessel ruptures due to severe hypertension usually. So the blood pressure is super high, and that can lead to artery rupturing because of such a high blood pressure. The effects are evident in both hemispheres if it's the cerebral artery, and it can be complicated by the effects of bleeding. Blood is an irritant in most tissues, and that irritant can exacerbate the initial damage. So you can see here the types of accidents. You have a thrombus. This is where it's a stationary clot developed by atherosclerosis in that initial artery. The gradual onset may lead to transient ischemic attacks, which occur often at rest. Increased intracranial pressure is usually low because it's reducing blood flow to the brain, so you don't see that increased intracranial pressure. Usually localized damaged. Embolism is where the source could be from the carotid artery or some other portion of the cardiovascular system. That blood clot breaks off, and then it gets lodged in one of the arteries of the brain. It's sudden. Again, it's minimal ICP, but it's localized unless there's multiple emboli. Okay, so these two are both clotting incidents. The last one is hemorrhagic, which is where the blood vessel bursts, often due to severe hypertension and damage to the arteries, inflammation and problems with the arteries. Since the blood is bleeding out into the intracranial space, we see an increase in the intracranial pressure. Often it's widespread and fatal. So these are really killing strokes. It's very important to diagnose the cause of the stroke early on because the treatments for each one are very opposite. So you need to find the cause of the stroke. If it's bleeding, If it's a clot, we want to break the clot up. But if it's bleeding, we don't want to break the clot up because it's just going to make more blood come out. Some risk factors include diabetes, hypertension, systemic lupus erythematosus, atherosclerosis, a history of transient ischemic attacks, increasing age, obstructive sleep apnea, heart disease, smoking, sedentary lifestyle. All those things can increase the risk of stroke. Also, oral contraceptives and cigarette smoking at the same time can do that. Congenital malformation of the blood vessels and increasing age. Signs and symptoms include really where the location of the obstruction is and the size of the artery involved. So the larger the artery, the more it's going to provide circulation, so it's going to have a bigger effect. And with the brain, there's a lot of anastomoses, which connect different arteries together and gives it a little bit of redundancy. So if there's more anastomoses in the area, then it's less likely to cause such severe damage. The lack of voluntary movement or sensation on the opposite side of the body. So the stroke's in the left side, it's going to affect the right side of the body. You initially can have some flaccid paralysis at the initial attack, but afterwards, over the next couple of weeks, you have spastic paralysis. Flaccid is where it's completely relaxed. Spastic is where it is taut, where the muscles are actually contracting and causing paralysis. There is a stroke scale that helps rapidly diagnose the diseases. So some important information. If you think somebody's going to have a stroke or CVA or brain attack, please call 911 immediately. They should go to the hospital as quickly as possible. And the time between the onset of stroke and treatment is going to be directly related to how much permanent damage is made, minutes to count. So with treatment, like I said, if it's a clot, you use clot-busting agents or surgical intervention. You can also treat with glucocorticoids and supportive treatment. Hemorrhagic, you're going to do a little bit differently than clot-busting. You can't use clot-busting agents with those. A lot of the treatment is after survival. After you survive the initial stroke, you go through a lot of occupational physical therapies, along with speech language pathologists. A lot of things have to be relearned, and then also treat the underlying problem. Cerebral aneurysms. This is where there is a weakness in the wall of the artery. So aneurysm is where you have this normally strong, elastic, tough artery, and instead of that, part of the artery becomes weakened and thinned out. So it almost bulges out in that area. So a cerebral aneurysm is one that's found inside the brain. And these usually occur where the blood vessels split and bifurcate. Okay? And there's more often to form this weakness. They get aggravated by hypertension, which is going to increase the size if somebody has high blood pressure. They initially are very small and don't have any symptoms. If it gets larger and maybe some small amount of blood gets seeped out, it can cause vascular type headaches because of the irritation. If aneurysm bursts or ruptures, it often leads to death. They're like ticking time bombs. They lead to a sudden fatal increase in the ICP, and they can lead to death. So we can see there are a lot of times that where the bifurcations are where the blood vessels divide. So here's a typical aneurysm here. Okay, and we see how the blood flows out and then it connects back together. That's what I meant by the redundancy of the blood vessels going to the brain. Signs and symptoms include, you see the signs and symptoms if the aneurysm is pushing on a particular part of the brain and causing the disruption. Okay, it's not ruptured yet. You're just seeing that it's pushing on it before. So a loss of the visual field if it's pushing on the visual areas, headache and photophobia, intermittent periods of dysfunction, neutral rigidity. That's neck in the neck where you can't move your head, caused by the meningitis irritation, so the meninges in the neck. Bursting can cause vomiting, seizures, loss of consciousness, those ICP related events. Treatment includes surgical treatment before the rupture and also keeping the blood pressure down through antihypertensive drugs. Just briefly, we talked about TIAs, cerebral, strokes, CVAs, and then we talked about aneurysms. Now we're moving into infections. Infections affect different age groups differently because they're different causative organisms. Often they are secondary to an infection somewhere else. So in children and young adults, we see things like Neisseria meningitis or meningococi. Meningitis it's the classic meningitis pathogen. Is frequently carried in the nasopharynx of asymptomatic carriers. So we notice we're asymptomatic from our COVID stuff. It just means you don't carry any symptoms, and then it's carried around in the nasopharynx and spread through respiratory droplets. Often occurs more frequently in winter and early spring, and it's spread in those settings where you have children and young adults, like in dormitories and daycares. With neonates, one of the common causative organisms is E. coli. This is often in conjunction with defects with the neural tube and the premature rupture of the amniotic sac. So when there's a difficulty with birth, given delivery. You can sometimes have cause infection, okay, and along with some neural tube defects. In young children, you often see Haemophilus influenzae, which is a flu type which causes infection in young children. And then with older adults, you see Streptococcus pneumoniae as a major cause. And like I said, that's it's going to probably be secondary to the pneumonia. Infection signs and symptoms include sudden onset is often common, so it happens very rapidly. Once it progresses to the brain, severe headache, back pain, photophobia, sensitivity to light, rigidity of the neck, Koenig sign, Brzezinski sign, vomiting. That's very important. Irritability, lethargy, fever, and chills with leukocytosis. And also you may have some stupor or seizures. The diagnostic tests for most infections are going to be through examination of the CSF. It should be aseptic, which means that there is going to be no organisms in it. So if we see organisms, we're going to try to figure out what it is. Then, after we determine that it is infected, we can use aggressive microbial treatment, including special treatments to lower the intracranial pressure and reduce seizures, and including reducing inflammation and edema. There are a few types of vaccines for meningitis, and that's one of the things. If you go stay in a dormitory at college, a lot of times they make sure you have your certain meningitis vaccines. So here's a slide preparation showing the neutrophils with bacterial meningitis. So there's abundance of neutrophils here. A brain abscess is where there's a localized infection. It's frequently in the frontal or temporal lobes. And since it's localized, it destroys that local tissue and usually has necrosis around that area, along with some edema. It can come from the spread of organisms through the ear, nose, throat, and including the lungs and sinuses. So it migrates to the brain, the bacteria, and then it grows. And it can result from septic emboli, which are infected clots that have traveled from the original site, such as the bacterial endocarditis. So the inside the heart, there are bacteria growing, they break off in a clot, travel to the brain, and then affect that area. So for treatment includes surgical drainage and antimicrobial therapy. And so you can see here's a frontal abscess. So it's a small infection in the localized area. Encephalitis. Encephalitis is with the infection of the parenchymal or connective tissue in the brain and spinal cord. So this is the connective tissue, which can lead to necrosis and inflammation of the brain tissue and result in permanent damage. The infection may also include not only the connective tissue but the meninges. Often viral in origin, but can include other organisms. Again, the signs include severe headache, stiff neck, lethargy, vomit, and seizures. So you can see, like, there are a lot of similarities between meningitis and encephalitis. So you're trying to determine which one's which and what organism is causing it. So a lot of different types of encephalitis are caused by vectors of mosquitoes that are transmitting the virus. So Western equine encephalitis is an arboviral infection caused by mosquitoes, spread by mosquitoes. Usually occurs in the summer months with children. St. Louis encephalitis affects more older people, more serious. And then West Nile virus, we've heard this one before again. the mosquitoes spread the virus around and cause this encephalitis. Lyme's disease is another one. It's transmitted by ticks, and it also has other symptoms other than just neurological. That's sort of kind of the last ones, but you can see that there's a bullseye lesion, along with sore throat, dry cough, headache, and then it affects the heart and the brain. It's very important to diagnose it. If you've been in the woods and you get bit by a tick and it turns red, and then you start getting sick, you need to tell your doctor you've been camping out in the woods. Herpes simplex encephalitis occurs occasionally, and it's usually from herpes simplex 1. It's just where it's spread to the brain, and it can lead to extensive necrosis and hemorrhage. Another infection is rabies. It's another viral infection, and it's transmitted by a rabid animal. And you can see a lot of these ones that affect the brain, they're all transmitted by some other vector. It's not from one person straight to the next for these infections. Transplantation of contaminated tissues. And with rabies, the virus travels along the peripheral nerves up to the central nervous system. So you can see the symptoms include headache and fever, nervous hyperirritability, sensitive to touch, seizures, and also can affect the salivary glands, which makes it difficult to swallow and cause a fear of fluids. And then it can also lead to respiratory failure and death. Tetanus is caused by bacteria Clostridium tetani. The spores of the bacteria survive in the soil for many years, and they can be entered in through an open wound, and then that wound is going to give a way for it to enter into the body, and once the bacteria begins to produce, it produces an exotoxin, which enters the nervous system and causes the symptoms, which are the muscle spasms, the jaw stiffness, difficulty swallowing, stiff neck, headache, and muscle spasm, and can lead to respiratory failure because you're unable to use those skeletal muscles. Poliomyelitis is caused by the polio virus. It is a infantile paralysis in children. It's endemic in West and Central Africa. There is immunization for it. We're trying to cure polio. It's highly contagious through direct contact or oral droplets. It attacks the motor neurons of the brain and the spinal cord and the medulla, which is the brainstem. And the symptoms include fever, headaches, vomiting, stiff neck pain, and then flaccid paralysis. A lot of children, before the vaccine was available, ended up on the iron lung because they couldn't breathe. And it, like I said, it paralyzed a lot of children. Herpes zoster, or shingles, is caused by the chickenpox virus, the varicella zoster, and it is comes years after the initial infection of chickenpox. The virus lives inside of the nerves, and then when it goes into a period of activation, it spreads down from the cranial nerve or from the spinal nerve down a particular dermatome, and you actually see this like little strip of rash that's exactly along the lines of that dermatome because it travels down that dermatome. It's very painful. It can cause tingling, and if it's a vesicular rash, if antiviral drugs are taken before at the onset, it can reduce the pain. The lesions and pains persist for several weeks, and post-therapeutic pain can persist for months to years in some cases. There is a vaccine available for those 60 and over. So if you had chickenpox before, you're susceptible for shingles later on in life. Post-polio syndrome is a syndrome that relates to the recovery. It happens after the recovery of the original infection. It's related to progressive and debilitating fatigue, weakness, and pain and muscle atrophy. So it's still dealing with the muscles and weakness. It's more severe than the original infection, and it has more severe effects. That's the post-polio syndrome. Reyes syndrome. The cause has not been determined, but is linked to a viral infection in children treated with aspirin. So children shouldn't take aspirin with a viral infection. Pathological changes occur in the brain and liver, and those changes in the brain, the function is severely impaired by edema. Okay, and also in the liver, it becomes enlarged and it develops these fatty changes in the tissue and can cause failure of the liver. The manifestations vary in severity, and there's no cure. But it's just it's a Reyes syndrome where we don't know the exact cause, but it affects the brain and liver in pretty specific ways. The Guillain-Barré syndrome, and there's a few different types: post-infection polyneuritis, acute idiopathic polyneuropathy, acute infectious polyradiculoneuritis. This Guillain-Barré syndrome is an inflammatory condition of the peripheral nervous system, and what it causes is it spreads pretty particularly through the body down these nerves, and there's local inflammation, and the myelinated axons become damaged, and there's axon destruction. Okay, this leads to impaired nerve conduction with both the motor function and the sensory function. Okay, and it spreads and it continues up the PNS. It is an ascending paralysis, which means it's starting in the peripheral and then coming up towards the central, which will eventually end up in the diaphragm and the respiratory muscles. So a lot of these patients end up with on a ventilator. The muscles get weak and the reflex response decreases. There's muscle pain and general muscle aching. Eventually it moves up and it can reduce vision and speech. The process can happen over a few hours or a few days. The primary treatment is supportive. There are a couple different versions of this syndrome. I had a family member, he actually had it, and his was opposite. His started up high and then worked this way down towards his hands and feet. Very rare case, and he ended up on a ventilator for several weeks because it took several days, extra days, to diagnose it. His treatment included plasma exchange because the autoimmune inflammatory response was so strong. Okay. Head injuries. Let's start right here.